Good afternoon, folks. My name is Shawn Zerke, and I am the chair of the Johnson County Task Force on Aging, and thank you all so much for coming today. I'd like to introduce Joe Sample, who is the director or the executive director for the Heritage Area Agency on Aging. They're based up in Cedar Rapids, but they cover 7 counties, including Johnson County, of which the Johnson County Task Force is one of the contributing groups to the Advisory Council. Joe is here today to talk about the area plan for 2018 to 2021, and he's going to give you some background. So if you would, without further ado, welcome Joe. He will come up.
All right. Well, thanks, Shawn. Well, I appreciate the invitation to come and visit with you all. We have just wrapped up within the last week our area planning process. So this is timely and an opportunity to kind of share with you kind of where we are with everything and introduce you a little bit further to Area Agency on Aging. At this point in time, we'll just try to hold questions till the end, but if something's just really boiling, we could take a pause. But in the interest of, I know we have a very specific time frame, if I remember correctly, Shawn, that we need to focus on an hour, correct? All right. So with that, a little bit about what we're going to accomplish in today's Aging in Iowa background. I'm going to talk and introduce you to the Aging Network, what that is, describe Heritage and its planning and service area, the process that we go through, going to discuss the area plan a little bit further, and I'm going to put on my Nostradamus mask and try to predict a little bit about the future of aging and specifically around Heritage and Iowa's Aging Network. We'll see how I do. You can take notes and check me in about 3 years. Maybe 6 months, depending on how things go in Congress. So a little bit of background then. I've been in this role now just shy of 2 years as the executive director at the Area Agency on Aging here at Heritage. Before that, I was with the Iowa Department on Aging, and I'll tell you a little bit more about who that is, and spent the last 20-some years in health and human services, both in the nonprofit sector as well as the government sector. So kind of a wide variety of backgrounds, but health and human services has been the focus of my entire career. I'm currently working on a PhD in Human Services and Family Studies. Human Development Family Studies, focus on gerontology. I have a master's in biomedical ethics and health policy and a master's in public administration. So that's a little bit about me. So we're going to take a moment to, you don't have to close your eyes, but if you'd like to close your eyes and imagine what comes to mind when you think of older adults and older people. And does the image like this come to mind? Well, in 1871, I believe, if my year is correct, this is Whistler's mother, and she was apparently 65 years old when this was painted. So I'm not really sure if that's quite the image that came to your mind. We also, of course, have nursing facility oftentimes comes to mind, but that's a very specific group that needs very specific care. In today's older adulthood, you might be starting to see something more like this. Now, we know for sure that not everybody's going to age, and they're not going to start running a marathon like the gentleman on your left-hand side at age 80 or 90. We understand that. But we also know that we will likely see healthier older adults. We also know that the age in which we will live is going to continue to expand and grow. We will likely have more 100-year-olds in the next 20 years than ever before in history. And as of today, we have more older persons over the age of 60 than ever before in human history. Ever before in human history. We've never seen this many older adults before. So we're taxed with, how do you do services? How do you do programming? How do you fund? How do you develop policy? So it's a really interesting time, not only in our culture, in our society, but just internationally. Older adulthood is a growing opportunity. It's a growing challenge for some locations and certainly for funding. But what we want to think about is, as we think about older adulthood heritage, we're not just thinking about that person who is requiring nursing facility care. We're thinking of that person who's going to age healthy in the community, and how do we engage that community differently so that we can have more of this healthy approach to aging. So in 2000, we all have heard the baby boom is coming, right? And what does that exactly mean? Well, this map shows you that in the year 2000, the shaded blue are persons over the age of 65, where 20% of that population is over the age of 65. So everything in blue, 20% over the age of 65. What keeps people like me up at night is this map. Okay? This is in 2030, where we anticipate a large number of Iowa being 20% or more of its population over the age of 65. Now, obviously, in the tan or beige color, whatever the color that is, that population, even though the percentage is not over the percentage of 20%, that number of older adults will still grow. It'll still increase. So we know the volume or the actual number of older adults will still be larger in all of those counties despite the percentage, okay? So we know we've got a population challenge, but we also know and hope that folks in those counties will be able to age in a way that's optimally healthy for them. And so it'll be up to us, the royal we, the collective of us, to figure out ways in our communities to challenge ourselves, to change the way we do business so that we can address the healthy younger old as we head towards a map like this in 2030. Here's another fact. How many of you are clamoring to get into a nursing facility as fast as you possibly can? Let the record show that nobody raised their hand. Now listen, there's obviously an extremely important aspect of nursing facilities. We absolutely must have them, and we must have the right support and the right funding for them. Because there are a certain number of folks who will have to go into a nursing facility because of their health needs. But the fact of the matter is that according to an AARP study that took place in 2011, 93% of those over the age of 55 want to remain in their community of choice, want to remain in their home if it is at all possible. You will also hear the same mantra from our partners in the disability community. So this is an overlap. This is an extremely important overlap between aging and disability that we want to remain in our home and our community. So it's extremely important that we talk about this both as aging and disability related. So let's talk about the aging network. What is it? It's not that the network is getting older, though that might be true, but it's called the Aging Network because of the Older Americans Act of 1965. And it was actually defined within that Older Americans Act. So in 1965, the Older Americans Act came about. It's been reauthorized several times, most recently in 2016. And it's been reauthorized through 2019, which tells us of challenge number one, which I'll come to later on in these slides, is we have to reauthorize this again under the current Congress or very soon within the next 4 years. And so we could have some real challenges to its reauthorization in the next 4 years. But the Older Americans Act establishes several things. It established 56 state units on aging or state agencies on aging. Now you do the math between 50 states and 56 state units. I don't know how you do the math on that, other than saying it's tribal units as well as territorial states. We also have every state has a state long-term care ombudsman's office, and the state long-term care ombudsman's office in Iowa is primarily charged with advocating for older adults who are in nursing facilities, and they can be reached at the State Unit on Aging in order to advocate for those residents in nursing facilities. And I believe they're up to 7 or 8 local ombudsmen who tour all of the nursing facilities in the state and talk to older adults. And they also have a unit now called the Managed Care Ombudsman, where they have 2 or 3 staff who are focused on Medicaid managed care in that office, and they provide reports through that office too. There are over 600 area agencies on aging across the country. They represent councils of government, which are groups or units of government. They could be counties. So like, for example, San Diego County is an area agency on aging, and they represent over 3 million people in San Diego County. That's the entirety of our state in one county in California. So I wish them well with their challenges. But we also have independent nonprofit 501c3 IRS tax status organizations, so your standard nonprofits. And I'll say this a little bit later in our slides here, but actually Heritage is one of the most unique of all of these in that we're actually a division of a community college. So we're a part of Kirkwood Community College. 244 tribal organizations and 2 Native Hawaiian organizations, and there's nearly 20,000 service providers that provide local supports and programming across the country. The majority of those contract with those local area agencies on aging in order to do the great work that is needed in those local areas. So that makes up the aging network itself is all of these things, but in the definition, it's really the area agencies on aging and the state unit on aging. So who are these folks that we are engaged with? So you have the Administration for Community Living. This is the bureaucracy, by the way. So you have money comes from Congress. We're authorized under a congressional act. Money comes from Congress. It's then run into the Health and Human Services, and then it's into this Administration for Community Living, or ACL. And Administration for Community Living is the bureaucratic top level of folks that we work with at the Agency on Aging in the federal government. Within ACL, then, is they have the Administration on Aging. In 2010, ACL was created as a combination of Administration on Aging and 2 other disability bureaus, if you will, at the federal level into the Administration for Community Living. Why? Because there's a lot of overlap in the work that we're trying to do, keeping people independent in their home as long as possible. So you follow the money, Congress, HHS, Administration for Community Living, Administration on Aging, and then it gets finally down to the Iowa Department on Aging, and this is that state unit. In Iowa, the state unit on aging is a standalone executive branch office of the state government. It operates independent of any of the other departments, so it's not part of public health. In many other states, it's part of usually the Human Services Department, which is funded by Medicaid or involved in Medicaid. In Iowa, it's completely separate. Its director is appointed by the governor, and that person is confirmed by the Senate of Iowa. So they have to go through a confirmation in order to be in that seat. Currently, Director Linda Miller is the director for for Iowa Department on Aging here in Iowa. And she was appointed in January, I believe was officially when she was appointed. So then it finally gets to us at this level, at the Area Agency on Aging level. In Iowa, we had, years ago, I'm sure there were many, but most recently, until about 2010, between 2010 and 2013, we had 16 planning and service areas. And on this map, that's the different colored groups. That's a planning and service area. And that there were 13 area agencies on aging managing the work in those planning and service areas. But in 2013, it was officially changed to 6 planning and service areas covered and charged by 6 area agencies on aging. Heritage, then, is over here in these, the 7 counties that surround Johnson County and Lynn County. So Benton, Jones, Cedar, Iowa, Washington. I think I've got them all. If I've missed somebody, I apologize. But that's the 7 counties, and as it turns out, that aligns directly with Kirkwood Community College's 7 counties that have its coverage as well. What you'll see are very, very large, I've got this pointer. You have very large areas, and this is a result of consolidation of those 16 different planning and service areas. So, for example, Elderbridge up here combined 3 different agencies on aging in order to cover that entire territory. Same is true in each quarter of the state. Aging Resources and Heritage were the only 2 that remained the same following the 2013, it was called the Modernization of the Aging Network activity. So this is our 7 counties. This is the area that we serve. And Heritage's mission then is focused on planning, funding, and advocating. And these are directly taken out of the Older Americans Act. As an area agency on aging, we are all mandated to be engaged in all of these kinds of activities. So our specific mission statement is that we will serve needs of older adults, caregivers, their families, and people with disabilities in the following ways. So through our planning and our funding and our advocacy, we intend to accomplish all those things. We do this both activities that we do as an agency on aging, but then also through the contracts of our partner providers throughout the region. So as I was stating, since 1973, Heritage has been a division of Kirkwood Community College. I have confirmed that we're the only one in the National Association of Area Agencies on Aging that's part of a community college in the entire country. But I was literally in DC talking and meeting with N4A as a board member of the national board, and I was informed that there may be one other community college in Houston that may be an area agency on aging. So now I got my work cut out for me to go and find them. But there are apparently 7 other agencies on aging that are part of either universities or other college contexts. But the rest of them really are nonprofit agencies, councils of government, or counties of government. And there's the 7 counties that we serve, and obviously that puts us in a unique academic setting compared to anybody else, really frankly, in the country for the most part. Our area plan is guided by an advisory council that Sean was mentioning earlier, and so there's task forces. If you're from Johnson County in this group, I'm presuming most of you are from Johnson County and not part of the task force. It's a great opportunity to learn, to be a part of the area agency on aging activities. It's also a great opportunity for advocacy related to issues that matter to you. But that advisory council then helps us develop and implement our area plan. The other thing to take note of is that all the area agencies on aging under Iowa Code 23164 have been designated as or established as aging and disability resource centers. The brand for that designation is Lifelong Links. Lifelong Links can be accessed either via the website, so you can go to lifelonglinks.org, or you can call this number to gain access to information and supports about what your needs are and how can we connect you to resources in the community that you, a family caregiver, an individual with a disability, or loved one may need. So that is not only a partnership online or via the phone, but and I'm going to point to Eugenia, who's our Lifelong Links manager, and this is Eugenia. Eugenia basically runs this part of our shop for us at Heritage. She also has an advisory council made up of extremely important partners from both the aging and disability networks, healthcare, and so it's really designed to be a 3-legged stool, online, either via phone or in person, getting access to supports and services through our network of partners. So that's Lifelong Links as an aging and disability resource center. Well, you can't talk much about anything, I suppose, these days without talking a little bit about your funding. So let me describe how in FY17, Heritage is established with our funding. Up here, you'll have IDA stands for Iowa Department on Aging, and this is about roughly a third of our funding comes from the Department on Aging. Nearly 45 to 48% comes from the federal government. A very small sliver is grant funding. This here is Medicaid, and I'll talk a little bit more about it. And then this is program income. Major changes in our funding structure, though, are occurring starting this next coming fiscal year. I'll come back to it a little bit more, but obviously none of you have heard, I don't suppose, of anything changing with Medicaid in the last year. Not a single change has happened, right? Well, for those who don't know what's happened, we've privatized it, and before Heritage had directly contracted with the state for its Medicaid services. Well, now we are directly contracting with one of the 3 managed care companies for our Medicaid slice of the pie. We have a dramatic change in how we'll be funded over the next several years. This will be part of our crystal ball wrap-up here. But a little bit about our population and how we're made up in this planning and service area. These are the counties we serve, and this is the general population. What I've tried to show you too here is this is the folks who are over the age of 65 per county. That is over here then the percentage of the entire population of those counties that are over the age of 65. So I said earlier that map was talking 20% over the age of 60. Well, that's 5 years difference between what the census data and what the state unit was able to capture. But what you're seeing here is 17, 18, 19, 14, and 18% of those populations. And I pulled Johnson County out, a very youthful group you are here in Johnson County at 10% of the population. And it would be the University of Iowa, I'm sure, that counts into this. But what you can see is our planning and service area is definitely aging. And we expect these numbers to continue to increase for the next couple of decades. So we're already right close to that 20% population number. Oh, and I should say then, the total population for older adults is 66,196 over the age of 65, according to the census data. And I would be remiss if I didn't mention that we have also over 31,000 individuals with disabilities. That includes children, so there will be a certain number of those that would fall under that data unit. But 66,000 older adults, 30-some thousand individuals with disabilities. And so we have a combined number almost of, right around 100,000 of people who need services and supports. Some need services and supports. All right, so the area plan itself. The area plan is a requirement under federal law. We have to submit a state plan or an area plan to our state units on aging across the country. And those area plans then are rolled up into a state plan that they then submit to, if you go back to that list of bureaucracy, they have to submit that plan at the state level to our federal partners. And by doing so, then Iowa then has its plan for the next 4 years about services and supports that it's going to be actively engaging in trying to assist the local areas. And that's basically our state strategy, if you will, around aging. How did we get to where we are with our plan? Well, the state had an area plan meeting with us in October 25th of 2016. And at that meeting, we were basically informed of what our goals were, what the mission was for our activities. So they outlined it for us. We then introduced our advisory council to this information in October of 2016. We had a public announcement period where we announced our area plan would be reviewed by the public, as well as an RFP, which stands for a request for proposals for funding. So we received that federal and state funding. Our job is then to also contract some of that out because we simply can't provide all those services internally. So we had this period of announcing a request for proposal. The Area Plan Development Day was an opportunity to pull folks from the community together to talk about the different goals of the area plan. It was kind of a broad brush strokes. A lot of great ideas came from it. From there, then, we jumped down and we had a public hearing in December of 2015. And by this time, we have generally some ideas as to what we need to accomplish within our area plan process. Our RFP, our request for proposals, then, were released to the public. And then those applications were scored mid to late February of 2016. All the public comments closed for the RFP in February. And then in March, and we're right here in March and April now, we put together our proposed budget for fiscal year 18. We outlined what we think our subcontracts will look like. And then a final area plan of comments were submitted on April, well, they were due April 3rd, but the reality is that we were able to submit them a few days prior to that. The advisory council then accepted the area plan that we put together as well as our fiscal year 18 budget. So we have something that we've submitted to the state. And what we want to share with you today really are some of those components so that you have a sense of what we're trying to accomplish in partnership with everybody. Each one of these goals were defined by the state unit on aging. Okay, so we didn't make these up. The state told us what they expected of us, but those goals actually were handed down to them even from the federal government. So the Administration for Community Living instructed the state unit as to generally what those goals needed to look like, and then the state provided this to us. So goal number one for our 2017 through 2021 plan is Iowa Aging Network will protect and enhance the rights and prevent the abuse, neglect, and exploitation of older adults, of older Iowans. This falls into two specific categories for us. This falls into our Elder Abuse Prevention and Awareness Program and our Legal Services Program. To kind of go backwards first, our Legal Services Program is contracted out to a local provider who's been with the Area Agency on Aging for over 40 years, providing that service. So if there are questions that you have about, or people have about guardianships, legal issues, there's a whole list of things that she can provide. But those would be a couple examples. If you can reach out to her to kind of start a process of getting information and assistance about legal support. Elder Abuse Prevention and Awareness Program. This is really, when I came on board about 2 years ago, This program was one that I really wanted to see strengthened within Heritage. Why? Because we know for a fact that we don't know very much about the population being injured or hurt by this, by exploitation. There's a lot of folks who don't either know they've been exploited or are unwilling to come forward and share because a lot of times they're victims from a family member. So it's financial abuse. It could include, of course, some of the physical and other violent abuse, but really what we're finding in our program is we're spending a lot of time on mental health support, on things like, the behavior that's called hoarding, where you kind of keep a lot of your possessions. So those are some things that we really work to help older adults with and family members. We have multidisciplinary team. Just to highlight a couple things here in Johnson County, is we are involved in a local multidisciplinary team. We're part of the Johnson County Older Adult Death Review Team, so that we can see if there's any suspicious deaths that occur in the area. And that we've received funding from the Victims of Crime Act. It's a brand new program, if you will. The Victims of Crime Act is not new funding, but what's new about it is accessing it for older adults. It's the first time they've really released those funds and taken a look as to how we work with older adults in their definition. We anticipate this is currently a 3-year grant, which is that very tiny sliver, but we hope that it will grow in our funding and become a very strong support component for our elder abuse prevention program. That is goal number 1, and those are the 2 primary areas of focus for goal number 1. And then identify best. So part of the strategy then is each goal has focus groups. Focus group number 1 is identifying best methods to reach potential victims of crime, and we have an entire process of how we might accomplish that. Goal number 2. There's a couple of sections for goal number 2. Iowa's Aging Network will work with older Iowans with disabilities and caregivers as they fully engage and participate in their communities, make informed decisions, and exercise self-determination and control about their independence, well-being, and health. And the way we accomplish this is through our Lifelong Links product. So our Lifelong Links service line provides information and assistance. It provides options counseling, which is supposed to be designed as a bridge between just getting information and longer-term case management support to build a short-term plan. Our options counselors are designed to be in there for a very short time. They give you some information, they help you build a plan, and then they step back and allow you to do what you need to do independently. You can always re-access them. But it's not really designed to be a long-term relationship. They want to help you get your plan so you get your legs under you and you can move forward as quickly as you can. Additionally, in order to address goal number 2, we have outreach, training, and education. This technically kind of falls into that as a training opportunity about the area plan and what we do. And our longer-term goal for this part of goal number 2 is to leverage our multimedia communication to increase use of the service. So we want to see more people using Lifelong Links, more people accessing our support services, and the way we're going to try to do that over the next several years is to really improve our social media context, our web presence, and marketing materials. So, like I said, there's a couple of components to goal number 2. The second part then is related to nutrition. So within goal number 2, nutrition and education education and counseling are provided at congregate meal sites, through home-delivered programs, and then also through our community partnerships. So there might be opportunities in the community where we can educate, enter into contracts with folks to provide counseling for individuals who are nutritionally at risk. So what we want to do is ensure nutritionally at-risk older adults receive education and counseling to limit their risk, to improve their health over the course of time. I failed to mention that the Lifelong Links component has its advisory group is our focus group. So we have a focus group for number 1, which is our legal services and elder abuse prevention. Focus group number 2 is our Lifelong Links Advisory Council. Focus group number 3 is our nutrition and counseling, and they are responsible for not only goal number 2 and the outcomes of it, but also then goal number 3, which is next. I'll have to skip ahead. I didn't put nutrition next, so I apologize. But they also have a group that will focus on goal number 3. For goal number 3, then, Iowa's Aging Network will enable older Iowans to remain in their their own residence and community of choice. And this is successful through our case management program. I needed to say, though, our case management program is not the Medicaid waiver program. This case management program is our non-waiver clients. So those who are at risk of slipping into Medicaid, those who are have several needs that we need to assist with, they are part of our case management program. The other things that we do under this is evidence-based healthcare activities. So we have partnerships to do powerful tools for caregiving. We have chronic disease self-management. We have what's called a T1 trainer. Joel Gleason is our T1 trainer for chronic disease self-management, and health promotion and disease prevention on a broader scale. The challenge we have with this, though, is there's not a ton of funding that's dedicated to this area. So we have a large challenge in how do we do a lot of this work with very limited funding. We really have to work with our partners to make sure that this can be successful. So under goal number 3, case management, evidence-based health activities, and health promotion are all part of activities that Heritage does. What this graph shows you, and maybe it's not going to show up very well for most of you, but what we're trying to do is I tried to show you the in-home services that we contract with our providers for include things like chore services, homemaker services, material aid, which is purchasing of something that might help you stay independent in your home, and then personal care. This is all funding driven. That funding that's available primarily from the state is dependent upon that in order for us to even provide a lot of these funding sources. Then we also have in the community. So we have in-home and in community. So obviously this is our, I know what happened. Here we go. I didn't have that slide come up. So this is our home and community-based services list. In the community, we have everything from adult day health services to transportation and assisted transportation, caregiving services, and that includes counseling and respite, as well as supplemental and material aid for those caregivers to help them take care of themselves when they're dealing with the stress of family caregiving. As an aside, family caregiving is a $495 billion unpaid industry in America. That's $495 billion with a B. Can you imagine? So imagine if you're a family caregiver, oftentimes you're doing sometimes quite complex healthcare activities with your loved one in her home. And so the healthcare system is really dependent upon you as caregivers. And so we try to do, it's marginal, it's not very much money, but we do try to provide some support and services for that family caregiver through this particular program. The majority of these services then are examples of things that we contract out to local providers. Remember that number of over 20,000 providers across the country? Well, we only have a small number. We have a smaller number, about 14, 15 to 20, depending on which grouping we're in. But we have roughly that many folks who do these various types of services. The largest majority of those folks, though, are in our nutrition program. So within goal number 3 and the nutrition program, we have congregate meals and home delivered meals. This is really pretty much the backbone of very much what we do and have done for many, many years. I will tell you that as a budgeted process for fiscal year 18, we made a number of changes and we really tried to bolster the congregate meal and particularly the home delivered meal side of our funding. The home delivered side of our funding ensures that isolation is reduced, and we know that if you can reduce isolation, you lower the risk for mental health concerns, you create connectivity, and you can get folks information about supports that they can access that they may not be able to access typically. Congregate meal sites, I think that there's a number of advocates who would say this is really kind of a changing time and a moving target for us. The older model is certainly in senior centers or community centers where you have, buildings where people come and congregate. What we're finding is the younger older adult is not interested in that model. And so we're kind of at this real interesting time in our policy and where we're heading for our services. How do we change our congregate meal site that's defined around federal rules so that it can be more innovative and change to meet that new, younger, older adult where she's at in the community? So we're kind of at this really weird crossroads, if you will, with our congregate meal program and where we're heading into the future. Stay tuned. We're still trying to figure that out. But what we can tell you is we're going to do in this next, over the next 4 years is really try to understand what that older adult, that younger older adult in particular, is interested in doing, where are they going, and how might we meet them where they are. It's important to note, though, that the meal program, the nutrition program, is heavily funded and supported by federal congressional dollars and for state funds. So when those dollars change, when they are reduced, we run a very high risk, especially since we're heavy loaded in our budget towards the nutrition program. If we see cuts, we run a very high risk of having to reduce the number of meals that we can deliver or to provide at a congregate site. It's the unfortunate truth. It's also the unfortunate reality that we're facing right now with money being tight. We know, unless one of you brought a checkbook, we're not going to see new money coming in very soon, okay? But if you do have a checkbook, no, I'm just kidding, okay? So to talk a little bit then about, to kind of wrap up the whole budget discussion, if you will. What we're expecting then in FY17 is this part of the pie is going to change for us and already has. Over here, this is the Medicaid dollar. Now, we are currently down to one contract out of 3 contracts for case management that is Medicaid funded. We have no idea with any certainty if that contract will survive over the next 12 months. We've heard a lot of rumblings that it might not. So this pie that we have in this budget is already smaller, even though it's not depicted here, but it's already smaller because this was built on 3 contracts. So this pie is already reduced by 2/3, this part of the pie. So if that final piece goes away, then this entire section has gone out of our budget. This next section up here then is program income. This is probably the biggest change to our budget, I don't know, in several years anyway, is that the program income has historically come back to Heritage and then redistributed to its partners. We've decided, though, because of these challenging times and because we needed to make a change to our nutrition program to try to strengthen it as much as possible, we are giving all providers the program income that they normally would send to us, and we're asking them to keep their program income at the local level, reinvest it as they see fit, so that they can then strengthen their programs and hopefully create some sustainability because of their own reinvestment. They don't need us to come in with this program income and help them redistribute the funds. They need to be able to become more independent with that money than what we were doing. So as you can see, it's a big impact on our budget, right? I mean, that's a big impact on our budget. But we feel it's the right thing to do from the local perspective. It's the right thing to do to hand the money back to them and let them make those decisions locally versus us trying to figure it out for them. So what you're seeing then is some big challenges for us. This is state money. Have you heard of any reductions to the state budget? So heading into fiscal year 18, this pie could see some impact. This part of the pie could see some impact. How about Congress? Are we seeing any potential cuts from Congress coming? So with that in mind, we could also see some cuts here. So we know we're facing some challenging times. We will obviously work, as long as it aligns with our general mission and vision, to continue to see what other grants make sense to either expand, to apply for. We know that we've got to find ways to diversify our own funding streams, but at this point, in this moment in time, we're trying to get our arms around moving forward into FY18, start building our strategies around what those next models might look like. But this is kind of our reality. We know heading into FY18, there will be some significant changes for our Area Agency on Aging. And frankly, this is not unlike the other area agencies on aging, not only in Iowa, but across the country. So shall we look into a crystal ball and see where we are at this point in time? All right. Well, just so you kind of understand the process, is that we routinely update the state unit on aging, the Iowa Department on Aging, about how are we doing on our area plan? Are we meeting our goals? What are the data outputs? Are we there? So we do that on a routine and regular basis. We also report those findings back to the advisory council so that they are informed as to how we're doing on our area plan. We've already talked about state funding reductions. We're going to see more of that. We had a de-appropriation for fiscal year 17. And we're expecting still a few more cuts for fiscal year 18 and 19 from the state level. From the federal side, again, I was just in D.C. last week meeting with congressional members. I can tell you that 90% of the questions were answered with "I don't know." Now, that's a very politically savvy answer, I think, because they really don't. But that was the most common statement was "we don't know." The other most common statement that we heard was "things are really going to be tough." So that wasn't the message I wanted to hear, I have to admit. But that being said, we were also there during a time when one of our congressmen, Loebsack, and some other Congress people were pushing forward for additional funding for the Older Americans Act. So while we were making our visits, we encouraged our congressional members to sign off on a letter of support for it so that they would authorize. They've already authorized the act, then they just need to fund it. And so we were pushing for them to at least encouraging them to think about that role. When I was there, missiles had not started flying in Syria, okay? And a big part of the challenge for fiscal year 17 at the congressional level is that many of the congressional members were saying that, our fiscal year 17 is really pretty set, and that's through October, or up to October of this current calendar year of October 17. But the Balanced Budget Act basically takes all of the defense spending and the non-defense spending and puts them on equal playing fields. And if a reduction or an increase happens, they're both moved at the same pace. That was, again, before missiles started flying. So I don't know in FY17 if there's going to be a change to that defense budget and how that might impact our current fiscal year. No idea. We don't have a clue. We just are hopeful that older adults, individuals with disabilities are counted for when we're talking about that non-defense spending. Block grants to states. We're hearing very clearly that in the not too distant future, the likelihood that the federal government will take that money that is state funding for non-defense funding, put into a block and grant it to the state, and it'll be up to the states then to decide how they divvy up those funds. So there's others who've been around longer than I have who experienced this. I think in the Reagan administration, something similar happened. And I have to admit, I really don't know what that experience was like from a nonprofit perspective. But I have heard that it was very challenging and it was very taxing on the state itself. The other, important impact is Medicaid. Now, and I'm not even talking at the local level. There's a lot of talk about Congress making moves to change how Medicaid is funded at the state level. And one of the things that, a stat that we had heard is that 2 out of every 3 people across the country who are in a nursing facility rely on Medicaid. Well, we did a little digging, and it appears that in Iowa, nearly 50% of the individuals in nursing facilities rely on Medicaid to help fund their stay in a nursing facility. To lose Medicaid funding or to change it dramatically is going to have an impact on our older adult population, especially those who are in need of residential care in a nursing facility. So it's extremely important for us to be aware of this number and to, as advocates, to consider where do you feel that money needs to be put, especially when it comes to that very vulnerable older adult. And then finally, the reauthorization of the Older Americans Act. Who are we going to serve starting 2020 and into the future? Is it the exact same population? Because if you go back to that very first slide I showed you, or not very first, but the pictures, older adults have changed since the 1960s. Has anything in your life changed since 1965? Absolutely. And so does the Older Americans Act need to catch up with where older adults are today? There's a lot of discussion that that might be the case. So we know that it's going to be starting to have some conversations at the national level, at the federal level, as early as next year, because we've got to get this on the radar in order for us to then actually make some changes to the Older Americans Act. So with that, that concludes the set of slides that I wanted to share with you. And this, of course, has some just my individual contact information, but obviously I want to encourage you, those who are on Facebook, and if you're not, talk to Eugenia. She'll help you get on Facebook. Yeah. I was just kidding, but she nodded her head. Go and like our page. We try to do as many updates, and know that we are really working to enhance our social media presence as the years start to unfold. So with that, I'll open it up to questions.
So if you do have any questions, Eugenia, raise your hand. Eugenia will come around with the remote mic. That way we can get your question recorded for the viewers at home. And I want to thank everyone for coming today. And if you have any interest in continuing to advocate for yourselves and for other individuals in this community, please join us on the second Monday of each month for our Johnson County Task Force on Aging meetings that we do hold right here at the Coralville Library. Oh, sorry. Meetings at 1, and then we typically have a forum or other type event like this at 2.
The second Monday of every month.
The second Monday of every month, yes. So May 8th and June 12th. And May 8th, we're planning for our next meeting. We're inviting our state legislators and lawmakers that represent us here in Johnson County to come and debrief us on this last legislative session at the state capitol. And then in June, we are talking about doing a forum on community gardens and garden sharing opportunities as it helps address some of the foods insecurity issues since gardening will be the big topic in June. So thank you very much. So raise your hand if you have a question. Eugenia will come out.
I had 4 questions,
Oh,
so
my-
I don't want to
I'll start writing them down.
Okay.
No, go ahead.
Number 1 is your agency able to approach the state about tax breaks for caregivers?
So the question is, can we approach the state about tax breaks for caregivers? And the answer is that we can educate about the opportunity that a tax break would give, for example, to a caregiver. Actually, at a Johnson County forum with legislators, when was Bobby and everybody here? A couple months back. In November, we actually shared with Representative Kaufman, for example, that Senator Ernst has a tax credit, a federal bill that she's been floating and trying to get signatures on for a tax relief or a tax credit for family caregivers. So we can educate, we can approach and share information about other examples, but to actively lobby and actively advocate would be a little bit different. But we have approached them to share those concerns.
Okay. Number 2 was, since we are limited on funds through Heritage and a lot of overlap of people needing services are also veterans, does your organization work with the veteran organization at all?
So this is a really good question. We know that heading into the next 4 years that we want to engage the Veterans Medical Center here locally differently than we've been able to in the past. What we can say is that what has recently launched and is starting to slowly get some additional traction is the Veteran-Directed Home and Community-Based Services Program. And so that veteran-directed HCBS program is run out of our Northeast Iowa Area Agency on Aging in partnership with both medical centers in Iowa City and in Des Moines, with hopes of expanding into the Council Bluffs, Sioux City area. There are programs that certain qualified individuals could work with through that program. That being said, we know that we need to strengthen our relationship with the VAMC here locally to see what other program we can do in partnership with them.
Okay. Number 3 was, you mentioned 50% of the Medicaid people being in facilities. Is that because being lower income, they do not have homes that they can stay in, as you mentioned at the first of your program for being assisted in homes?
So for clarification, those who are in nursing facilities, the numbers that we think we've got is that 50% of those who are in nursing facilities, older adults, are on Medicaid, and that Medicaid helps provide funding for their stay at that nursing facility. Our whole goal, our whole intent, see, the fact of the matter is that if you look at 100% of the population, roughly 3 to 5% of that population is on Medicaid or utilizes Medicaid. we know that an additional 5% are at risk for sliding into Medicaid. And then you have basically 90-some% here on the outside who could certainly access heritage-related services, access our partners. We know that those who are not in the Medicaid roster is or are at risk for sliding into Medicaid are of special interest and emphasis for our programs by federal rules, because we need to get to the most vulnerable, the most at risk for sliding into Medicaid, or at risk of not being able to stay in their community of choice. So, our intent is to really try to focus on that few percent who could slide into Medicaid. Those who are in Medicaid then receive funding from Medicaid, and we really don't provide any services or supports other than that contract for case management for Medicaid folks. Does that kind of answer your question?
No.
Okay, try me again.
All right. Middle class,
Oh.
upper class can own their own homes.
Okay.
A lot of Medicaid people are lower incomes. They rent or they have homes that are not adequate
Right.
for them to be able to stay in. Is the higher percentage have anything to do with this?
It certainly has to do with income, but it also, you have to be able to meet eligibility criteria to even get into some of those facilities, right? So there's an assessment and a checklist that helps a person migrate, if you will, into that residential setting. But there are private pay options. There are different ways that folks can get assisted living. They could get independent living through other housing opportunities. But the folks who are using Medicaid to be in nursing facilities need the medical support and have reached a certain poverty level.
Okay. And my last is very short. You mentioned that you're affiliated with Kirkwood
Yes.
Community College.
Mm-hmm.
So what is it that Kirkwood Community College does with Heritage that makes you affiliated with them?
Well, the simplest answer to that question is that back in 1973 or whatever it was, 71, they applied to the federal government, and the federal government said, or I'm sorry, to the State Unit on Aging, and the State Unit on Aging said, yeah, you can be an area agency on aging. It's my understanding that all the way at the beginning that most area agencies on aging under Governor Ray were in community colleges around the country. All of them. All of them were part of a community college. And then over the course... Yeah, Governor Ray made that decision. And so over the course of time, we've all kind of gone our disparate ways. And Heritage basically stayed on site with Kirkwood Community College and continues to serve its 7 counties. Our partnerships, however, include, we provide some opportunities for students to come and work on our facility or work at our facility, to work with clients, to get nonprofit experience or what would be in the health and human service experience. We also advocate for the direct care workforce improvements. We provide education and training. So there's additional things that we're working towards along with continuing education opportunities for older adults to work with Kirkwood. But we're just still really trying to strengthen, even after all these years, to re-strengthen our relationship with Kirkwood so that it's really genuinely academic in nature for our partnership. Thank you. Hi, Betty.
We already know that the Trump administration is going to cut about 18% off of your budget. You've used Meals on Wheels, to me, are the most vital thing that you do because it has contact with many people who otherwise I work with it and I know how vital it is. Do you have any idea how you might make up for this?
Well, that's a terrific question. So that 18% is a very recent number that we've seen, and we literally just last week started running numbers around that 18% mark as to what that would look like. At this moment in time, all I can say is the first reaction would have to be to reduce the program. Unless we had other funding streams come in and other resources come in to support it, we would be limited as to what else we could do with the meal or the nutrition program. So my deepest concern is that it will negatively impact Meals on Wheels and congregate meals by a reduction in response to Congress reducing those numbers. So no additional game plan as of yet.
So we all should contact our.
Well, okay, so Betty, I'm going to say what Betty said. She said, contact your representatives and your senators, and yes, absolutely. I mean, look, the importance of our nutrition program is well-founded over the course of 30-some years, or 40, 50 years now, actually, that we've been doing this. So the reality is that unless people let their legislators know its importance, it could go, by the wayside and be forgotten in this conversation. So we certainly encourage you, and Betty encourages you, to get out there and advocate for making sure that funding, because they reauthorized the act last year. So if you reauthorized it, you really should be funding it. You made it was a unanimous vote, by the way. Yes, I know. That's our hope. Yes. Last question. Thank you. Harry.
We know that one of the reasons that older adults have to leave their homes usually is because of a disability of some sort, that their home is not accessible. They just can't stay there. Has Heritage done anything in working with residential contractors and realtors to encourage more zero entry and accessible homes be built?
Yeah, so great question. The question was whether or not Heritage has directly engaged with builders and contractors about gero-fitting, it's a great term, by the way, gero-fitting, residents so that older adults can remain in those communities. And I can say that in the couple years that I've been on site, we have not specifically directly worked with builders. I know that we participate in community forums, that we encourage it, but I think I would be out of line to say that I've sat down in a meeting with a builder and said, you really need to be doing this. But as for your plan, one of the pieces that we recognize is exactly that we want to encourage folks to have universal design, that new buildings need to be, retrofitting can become expensive, so build it right in the first place is the stance that we would generally take. Or say it again? Or impossible. Or impossible to retrofit, correct. So thank you very much.
Thank you, Joe, for coming. Again, I would like to encourage any of you that are interested in receiving this PowerPoint or participating in Johnson County Task Force on Aging, please leave your email address on the sign-up sheets in the back. Thank you.
Thank you.